Hi, my name's Scott. I'm a nurse manager with Bright Star Care, and today I'm going to be talking to you a little bit about Lou Gehrig's disease, or as it's more commonly known today, amyotrophic lateral sclerosis, or ALS. Now, ALS is a disease where the motor neuron is affected and ultimately destroyed, and what happens is the disease attacks these motor neurons, and the motor neurons are responsible for telling our muscles what to do, to contract or relax. So what happens in the disease process is it basically knocks out the message center. So the muscles sit there, don't know what to do, and end up wasting away. And that's also why ALS is known as a muscle wasting disease. It's because of this process that's interrupted because they're not contracting and they atrophy. Now, ALS affects 15,000 Americans, and for an unknown reason, military veterans are twice as likely to acquire the disease. It can affect anyone of any age, so there's no barrier there, but it normally shows up between the ages of 55 and 75 with a 3 to 5 year prognosis. Now, someone with ALS would experience muscle twitching, cramps, stiffness. They might have trouble chewing or swallowing or even speaking because all of these are controlled by the muscle tissue. As the disease progresses, it starts to affect the breathing. So eventually these patients or people will need assistance breathing, and that's when you see machines like a BiPAP or CPAP, which help put airway pressure in and help inflate the lungs and breathe to kind of take up where the muscles left off because they're not doing their job like they should be. But you'll also see things like cough assist machines and a lot of the symptoms, because there is no cure for ALS, a lot of the symptoms are usually managed by medication. Now, if you have ALS or you know someone that does, there's resources out there for you, or support groups, and to name a few, the ALS Association, Project ALS, or the Les Turner ALS Foundation, in addition to local support groups, give a lot of good information, and they're also very giving tips or tricks in coping and how to deal with the disease and what they've learned going through their process. So it's very helpful in that regard too, in addition to the emotional support and the community that they provide. Now, if you're a military veteran or you know someone who's been in the service and they develop this disease, the U.S. Department of Veterans Affairs actually recognizes this disease as a service-related disease. So they're going to want to contact their VA office to get help benefits that way. And that's pretty much it. That's all I have to say about ALS.